Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our Wednesday Zoom news conference for the latest in COVID-19 information and updates. Let me go ahead and introduce who is on our panel today for our Zoom news conference. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer of Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Mark Rielo, Acting Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is I'll turn it over to our panel for a brief statement from each panel member, and then we'll take questions from our media. Let me go ahead and turn it over now to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. It's interesting. We're starting to adjust to living in a COVID-19 world, and I think our change in press conference schedule reflects that. We no longer feel like we need to be having an avenue to communicate with citizens 3 times a week, but hope that we can make the most of your time and give you the best information by just dropping back to once a week. And I think that's an indication of what's happening to all of us in our family lives, our work lives, in our city life. We're beginning to adjust to living into a COVID-19 world. The city wants to be here to provide you as much information as we can and all of the information that you need to keep you and your family safe. So we will continue doing that, but as we see the need to shift these press conferences, they may shift. But I just thought it was interesting, and I think it's relevant to the fact that we're all learning how to live in a COVID-19 world. I expect that we'll be continuing to get Governor Abbott's guidance on how to finish reopening our businesses and get us all the way back to normal activity as he sees that it's safe to do that. As for timing or specifics on when that will happen, I don't have that visibility yet. So we'll get it to you as soon as we have it. I do think it's still dependent on us. The governor's watching our numbers, and what we need to do is be responsible individually. So to the extent that we can maintain social distance, if you will be intentional about washing your hands more during the day, if you would wear a mask, not for yourself, but you would actually be wearing it for others, those are things that will keep our city safe over the long run. Our team here is working on the criteria for changing our level. Right now, our city has been at level red on the coronavirus scale, and I think it's likely that we will soon move to level orange, go back as we're watching our numbers plateau. And I feel good about where we are in the city. I think it will be appropriate for us to go back to level orange pretty quickly. But we're working on defining the criteria for that so that we can communicate that to you as citizens. But I think this will be a useful tool. No one knows how long we're going to live in a COVID-19 restricted world until we have vaccines and medicines to treat this virus. But what we can do as a city, I hope, is provide you as a citizen a tool through these color levels that tells you when you might need to pull back in your business or when you might need to be extra aware, extra cautious for your family. So as we develop this tool, we'll communicate it to you more. But I wanted to put it out there that I think we'll soon be going back to level orange as a city. So that's what I have today, Dave. Thank you.
Thank you, Mayor. This time, let's go to Casie Stoughton, Public Health Director for the City of Amarillo.
Thank you, Dave. For a numbers update, as of yesterday, and I'm sorry, there's kind of an echo in this room, so if you'll kind of bear with me. As of yesterday, there were a total of 3,143 cases of COVID-19 reported in Potter and Randall counties, 2,432 in Potter County, and 711 cases in Randall County. We have a total of 968 recoveries and 37 deaths reported in our community. That leaves us with a total of 2,138 active cases. Each of the cases represent a unique individual. Staff work to remove any duplicated test results before reporting the numbers for that day. Amarillo Public Health and Amarillo Fire working together along with nursing facilities to comply with the governor's order to test all staff and residents in nursing homes. The numbers are fluctuating as tests are conducted and test results are coming in. So there have been a total of 2,320 tests conducted in nursing homes. So far, Amarillo Public Health has received 67% negative, 6% positive, and 27% are still pending. It's good that we've stayed that 6% positive rate from last week. There are 14 nursing homes and 11 have COVID positives identified. As far as JBS testing, we're still continuing to see results from the mass testing that was provided by the state of Texas there at the JBS plant. A total of 821 residents from Potter and Randall counties were tested. And as of today, 62% of the test results are negative, 20% are positive, and 19 are still pending. We have continued to update the dashboard that's on AmarilloAlerts.com. We always want to make sure that we're responsive to the needs for information. And so if you'll check that out, the dashboard there at AmarilloAlerts.com, you'll see zip code information. You can click on the different zip codes. It's kind of, it looks like a heat map there. You'll see the different colors representing the different levels of disease per zip code, and you can click on a zip code and it will tell you how many cases in that zip code and how many recoveries so far in that zip code. We also have hospitalization data, so that is an aggregate of all of our hospitals that are reporting that data to us, and so we hope that that information is helpful to you. Thanks, Dave.
Thanks, Casie. This time, let's go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
Is that better?
Yes, we got you now, Dr. Milton. How are you?
Okay, good. I don't have much to report this morning, Dave. I think things are going better. I wanted to reiterate what Mayor Nelson said about trying to wear a mask when you're getting out and about. And then I'll let Brian and Michael talk more about the status of the hospitals. Thank you.
Thank you, Dr. Milton. This time, let's go to Dr. Brian Weis, Chief Medical Officer, Northwest Texas Hospital.
Hey, good morning from Northwest. So I don't think there's any doubt that the trends over the last couple of weeks have been very encouraging. I mean, I got a haircut. That was really exciting. Almost had a comb over. Anyway, let's start with the numbers at Northwest. So basically, we are down to 15 confirmed positives at Northwest this morning. 7 of them are in the ICU. Only 2, thankfully, are on ventilators. So, and then we have 1 person under investigation in the hospital. So we have seen a reduction in the number of positive cases in the hospital by 1 to 2 a day since about the 2nd week of April. So very encouraging. And especially now that we're down to just 2 ventilators being used for patients with COVID. We have treated 18 patients with remdesivir, and that's been under the guidance of Dr. Milton, and that's the antiviral that's shown some promise. I think what we've seen is kind of a mixed bag. We've seen some patients make some great recoveries, and then some that didn't respond quite as positively as we'd hoped they would. We're also treating patients with a drug called tocilizumab for this cytokine storm. We've had 22 patients treated with that medication. Same thing, kind of seeing some people seem to respond, others not, but still learning a lot about how to use these medications and how people respond with the virus. As Mayor Nelson said, we are pushing back to some form of normalcy. So that includes we're going to now de-escalate on our visitation restrictions. So that means that we will now allow 1 person per room to visit patients in the hospital. For our ladies who are expecting, we'll have 2 visitors. That's usually going to be dad and grandma-to-be can be in the room with a woman who's expecting. We will still restrict visitation for patients who are COVID positive, but that may change in the near future. We're continuing to increase elective procedures. Up to this point, we were testing every person that was coming for a procedure. We're going to de-escalate on that a little bit and say, depending on the procedure and risk factors the patient may have, we may only test a certain number of people, and others we may be able to say that there's no need to test them. And then lastly, I just wish to personally thank the community for the incredible support for the hospital. I mean, we've had more food and gifts brought into this hospital. I think our whole staff is 400 pounds now. It's been incredible. the support from the community. So thank you again, and that's what I have for this morning.
Thank you, Dr. Weis. This time, let's go to Dr. Michael Lamanteer, Chief Medical Officer for BSA.
Good morning. Thanks for having me on this morning. And unlike Dr. Weis, I cut my own hair. So as you can see, I don't need a barber. We're doing very similar to Northwest in terms of our numbers, with a gradual decline in the number of positive confirmed COVID-19 inpatients. We're down to 19 patients today that are in our facility that are confirmed. We have very few patients under investigation. Those are the ones that come in that we're testing for COVID to see if they're positive. And the reason for that small number is because of our rapid PCR testing, which allows us to turn those results around very quickly. We're in pretty good shape with our rapid test kits, which is allowing us to really be in a good position to move patients through properly and make the appropriate designations in terms of whether or not they are infected. And it helps us to conserve our PPE. We're also doing much better on PPE and are looking at other strategies where we can potentially modify our policies to be more careful in regard to how we utilize the PPE and protect our staff. I want to talk a little bit about testing. We've done nearly 3,000 tests since the outset of the pandemic in the Amarillo region. And of those 3,000 tests, the majority of which have been outpatients that have come through BSA laboratory and been tested. About a 19 to 20% positive rate is what we've been seeing, and that's held consistent now for at least a month's duration. It is interesting also that we are doing, and when we talk about the reopening phase, we are doing preoperative testing in a selected number of patients. From the get-go, I was really personally opposed to testing everyone preoperatively because I felt like a focused procedure was a better route. And interestingly, with the focused effort, meaning we screen people for symptoms, and then we look at whether or not you're coming into the hospital as an inpatient with a likely scenario beyond your surgical procedure. Those are the individuals that we've tested, and we've had an extremely low rate of positivity. Less than 0.5% of those patients have tested positively. And I think if we augmented the denominator, it would be even lower. So again, that is a very good sign in terms of the hospital being a safe place to come and get your procedures done. We've very carefully opened up over the past couple weeks and have been doing screening otherwise outside of testing in terms of how we question patients and their household contacts about whether or not they're a higher risk for potentially having COVID. If they have that type of exposure, then of course we'll go ahead and test those individuals, but it has been a good process for us up to this point. We have utilized remdesivir, which we've been very happy about receiving and getting from the state allocation. Dr. Milton has been helping us out in terms of selecting proper patients. It's still too early to know exactly what the results are going to be from this trial that's being utilized with remdesivir and how we use this drug, but so far we've had some pretty good results in a small number of patients. We've treated a larger number of patients with convalescent plasma therapy, and the majority of those patients have done well. Others have not done as well, and it appears that the earlier we're able to give patients the convalescent plasma therapy, the better their outcomes are. Still, I think this is another modality that suggests that it's just too early to know what the best therapies are going to be. And again, probably a year from now, we're going to have a lot more ability to retrospectively look back and say these were the better options that we need to continue to treat our patients with. I think it's also helpful for us to mention that visitation, as Dr. Weis mentioned at Northwest, is also being evaluated very carefully at BSA. We are planning to augment our visitation policy in the very near future. We're going through a few of the final details regarding how that's going to work. I think it'll be very similar to what you heard from Dr. Weis at Northwest. There still is a need to be in this kind of what we'd call a yellow caution zone with our visitation, not the red zone where we have been, which is essentially no visitation for those of you that know that have loved ones in the hospital. And then the old world of, I'd say, green level, which is fairly unrestricted visitation. We're not there yet either. But I suspect that in the next couple of days, at the latest, early next week, we will be in that situation where we'll be having an augmented visitation policy at BSA. Again, we'd like to make sure we take this 1 minute to thank our staff, all of our nursing staff, therapists, physicians, EVS services, dining services, everyone who's coming here every day to work at BSA, putting up with all of the difficulties that we've had over the past couple of months, managing this new environment and new world. They've done an outstanding job, and we're very proud of our employees and our non-employees that come to BSA and work and take care of our patients. We want to also thank Mayor Nelson for her hard work, Dr. Milton, Casie Stoughton, and also the other city representatives. And Dr. Weis and I have been collaborating very well, and I'm very appreciative of that relationship. Thank you.
Thank you, Dr. Lamanteer. Let's now go to Mark Rielo, Acting Director of the Amarillo VA. Mark, how are you?
All right. Good morning, everybody. Thank you so much for having us today. I'm happy to report that the Amarillo VA healthcare system is now going on about 2 weeks now with 0 positive cases admitted into our hospital. We are currently monitoring 11 positive cases right now on home quarantine. We have an additional 6 PUIs that are still awaiting results, and we're also happy to report that we've had 4 recoveries so far from our veterans. And recently, the Department of VA actually announced its reopening plan across the country. And here at Amarillo VA, we are looking at targeting of July 6th as our reopening of limited services for our veterans here on the Amarillo campus. And we are also targeting a tentative date of June 15th, actually, for limited services in our outlying clinics. Now, these dates may actually move back forward or backwards, depending on the conditions as the data presents to us every day here. So as a high reliability organization, we definitely value the safety and it's paramount to us, and we will continue to guide our decision makings based on the data that's available to us. While we may not have a full spectrum of care at this time, the Amarillo VA will definitely consider the unique circumstances of our current conditions, environmental safety preparedness, and also any risk assessments. But also just to let our veterans know, we will still continue to offer virtual care to our patients at this time. So meaning through telephone or through our VA Video Connect capabilities. Recently, also the VA announced a change in emergency care for use in our non-VA facilities. So previously, the hospital or the veteran would need to notify the VA facility directly. But as of Monday, a new national VA centralized call center actually will be available for veterans to call within 72 hours of arriving at a non-VA emergency facility. So veterans no longer need to call their local VA for notification of non-VA emergency care. Either the veteran or their family member or the non-VA community provider may call the centralized call center at 844-724-7842. Again, that number is 844-724-7842 for any non-VA emergency care. Finally, I'm proud to announce that Dr. Rodney Gonzalez will be officially coming on board this Monday, June 8th, to serve our veterans as our permanent medical center director for the Amarillo VA healthcare system. Dr. Gonzalez recently retired from the Army as a colonel, where he last served as the chief of staff for the Walter Reed Medical Center in Washington, D.C. So we're definitely blessed to have a combat veteran with his extensive healthcare pedigree to lead our veteran organization into the future. And I also want to thank our employees and family members and community partners who definitely shown us the support here at the VA Amarillo healthcare system. We want to thank everybody that comes in and day out to give the best care we can to our veterans here. And also thank you, Mayor Nelson and the City of Amarillo for allowing us this time to speak to our veterans and their families in the Texas Panhandle. Thank you.
Thank you, Mark. At this time, let's now go to City Manager Jared Miller.
Thank you, Dave. I just want to remind everyone that the drive-through testing center is still open. If you feel sick and you have symptoms you think might be COVID-19, please call the public health hotline at 378-6300 to be screened for the drive-through testing center. With regard to GA23, the governor's executive order, we are under phase 2 of the reopening under the governor's plan. It includes not only Amarillo, but all of Potter and Randall counties as well. We are on the same schedule now as the rest of the state. As a reminder, youth sports programs and recreational sports programs for adults could begin practices on May 31st. No games or competitions can be held until June 15th. For more information on how the governor is working to open Texas back up, I want to encourage everyone to go to gov.texas.gov/open Texas. Or you can contact the governor's office main switchboard at 512-463-2000. Utility billing, as a reminder to our customers, the utility billing department is accepting walk-ins at Amarillo City Hall, adhering to social distancing policies. Utility billing and vital statistics customers can also utilize curbside payment services. Customers wishing to utilize the service should enter the City Hall parking lots from Buchanan to leave payments in a drop box, and from Johnson Street to pay by credit card. Building Safety Department is also open and following social distancing guidelines at the Sims Municipal Building. Rest of our departments are also open, but accepting appointments, requesting that people make appointments so they can bring them in one at a time. And that's to avoid the social distancing challenges that come with some small waiting areas. That's all I have, Dave.
Thank you, Jared. At this time, we're going to turn it over to questions from our local media. We have the question for an individual panel member or the panel as a whole. That's perfectly fine. Let's go ahead and start with David Gay at the Amarillo Globe News. David, how are you?
I'm good, everybody. Hopefully everyone's doing well. I guess the first question I have is, I guess with the spike in recent outdoor events, whether it be in-person graduation or various events, protests, marches, rallies, and stuff like that. I mean, I guess this is a question for the panel. What would your recommendations be about going to those events if people want to, in a safe manner, just to continue wear masks and practice social distancing?
Yeah, so I think that, anytime that you're in large groups, and we've talked about this, I think, many times before, anytime you're in groups, then that risk goes up. So social distancing, wearing masks, good hand sanitizing is always important. So I think absolutely, and it's good to do those things.
Do we foresee any spike still to occur, either from JBS, nursing homes, or potentially any of these outdoor events that have occurred or are occurring in the next few days?
Right now, the JBS and the nursing homes, those positivity rates are staying fairly low. Between 6% at the nursing homes and 20% at JBS. I think right now we're starting to see some positive cases potentially from Memorial Day get-togethers, and so anytime that we are in groups, it's good to have 6 feet of distance, to be wearing our masks. If you're sick, just don't go. And I think that's the key, is to be thoughtful of the others that are going to be there.
Absolutely. And Dr. Weis, you talked a little bit about administering remdesivir as well as this other medication, which I didn't get the chance to write down. Can you talk to me a little bit about the differences between the two and kind of what you've been seeing about how it's affecting those patients with the virus in different ways?
Sure. I definitely would like Dr. Milton to step in too, because he's really the one who's been following closely. But the remdesivir is an antiviral, and so that's going to act directly on the virus, or at least we hope it is. That the tocilizumab, and don't ask me to spell that, but tocilizumab is a drug that actually reduces the cytokines. So cytokines are the chemicals and the signals in the body that are related to inflammation. We know that is the cytokine storm is when people get very sick. So this tocilizumab is a drug that's actually used in people with arthritis, which is an inflammatory condition. And the hope is that in this situation, it de-escalates that cytokine storm. So we're doing that. We're also doing plasmapheresis, which is a way of, again, it's almost like dialysis, where we're trying to clear these cytokines from the blood. So the belief is that if we can reduce all those markers of inflammation, all those signals of inflammation, maybe it'll equate to a better clinical outcome for the patient. That's still not known, and that's still speculation, but that's what these therapies are trying to do, is reduce that cytokine storm.
Yeah, I would just add that's very well said. What Dr. Weis has said. It's none of these drugs have been shown to improve mortality. Even in remdesivir has not been shown to decrease mortality. But there is a good clinical study that involved about 1,000 patients that showed that the hospitalization was decreased. The length of time was decreased about a third. So there's probably more data to suggest the use of remdesivir at this point in time. I think as time goes forward, there's other clinical trials that are already being started, and we'll know a lot more of these answers of what the best treatment protocol is, probably in 6 months or a year.
Okay, and the last question that I have is actually for you, Dr. Milton. I mean, with the increase of recoveries over time, have there been, are people in the community still willing to donate plasma, and how is that stockpile here locally?
I think the stockpile here is pretty good, and there have been people that are still willing to donate. I think there's been close to 12 or 15 local donors, and I think it's also important to realize that can be saved, that can be frozen, and we can have that in the bank. I think it can be utilized for up to a year after it's collected. So I do think it's an important resource.
Absolutely. Well, that's all the questions I have. Have a good rest of your week, guys, and stay safe.
Thank you, David. This time, let's go to Aaron Langston, KAMR Channel 4. Aaron, how are you?
I'm good. How are y'all? First question, do we have a total number of JBS employees that live in the Potter Randall area, and a total number of how many of those tested positive?
So I have the total number of people who were tested, and that's 821. I'm assuming that that's the number of people who are employees and who are residents. That testing was conducted in another jurisdiction in Moore County by the state of Texas. And so we are receiving those test results as they come in, but I don't have, we didn't do that testing, so I don't have all of that data. I have right now that we have 20% of that 821 are positive.
Okay, and you mentioned last week about the group that was handling the nursing home testing starting to shift towards assisted living. Has that began, or are we still waiting on the okay for that?
So we don't have an order from the governor. However, our fire department and our nursing, our assisted living and group homes, we've reached out to them and asked if, so that we can be proactive when that order does come. We wanted to have kind of a step ahead. And so some of them have said yes. And so we appreciate those who wanted to go ahead and be tested. And so we're working through that now.
Okay, and last question. With the recent spike in the past week or so from TDCJ, the Clements unit, has that put any more usage at the hospitals, or those more asymptomatic and staying in house out there?
I don't have that data. If you do, Dr. Weis, did you?
Yeah, so Northwest is the go-to hospital for the Texas Department of Corrections. So the truth is at the peak of this, about a month and a half ago, it was really the bulk of our MICU was occupied by inmates from the prison. We are not seeing that now translated into hospitalization. So I know that I've talked to the doctor out there. I know they're doing some great work on contact precautions and really kind of securing those inmates where there's not so much interaction. It sounds like they're doing a great job of mitigating a lot of that spread, and we're just not seeing the hospitalizations like we saw about 4 to 6 weeks ago.
All righty. Well, thank you very much.
Thank you, Aaron. This time, let's go to Dalton Williams. I think is a new reporter at KVI Channel 7. Dalton, how are you? Welcome.
Hi, thank you. I'm doing well. Thank you. My question is for the panel, but probably more for Jared Miller. With phase 2 and us reopening with bars and movie theaters and bowling alleys, what are y'all's concerns about reopening and with people probably trying to abide by social distancing, but not really at the same time?
Excuse me. Yeah, the biggest, pardon me, the biggest challenge is just to be responsive to reports of too many people. We've been doing that. It's much more challenging to enforce social distancing, and enforce is probably the wrong word. To get people to take seriously socially distancing, wearing masks, things like that. Those are all recommendations from the governor. With regard to the occupancy limits, though, those are things that we are actively working with all of our businesses, not just the bars and other establishments, to make sure that they're observing. The governor's charged us with making sure that those are being observed, and we're doing that. We're being responsive through our environmental health department as well as our fire marshal's department. So if you're aware of something like that, let us know. We're also proactively looking into at a variety of different businesses to help them make sure that they're observing those occupancy limits. But from a social distancing standpoint, that's something where everyone's going to have to take responsibility for their own actions and maintain that distance.
Okay, and then if we do, even though we are starting to plateau, if we do start to see a spike, would we have to regress backwards in closing the bars and stuff again? And how would that go about? Would y'all release a presser saying we need to close again, or how go?
Yeah, absolutely. If that was to happen, if we had a significant, if we retrogressed or if we went backwards, had more cases, that would be something, one, that would first be driven by the governor. The governor's orders are very clear that his orders are the only ones that guide what's happening as far as reopening or closing. So we would, if we felt a need there, we would work with the governor to implement some type of regional or tightly focused geographic area that would be affected by some type of backwards move like that, or some type of more restrictive move like that. But it would not be done at the local level. That would be something done by the governor on our behalf or for us. So I think I got all the question there. If I missed some of it, please let me know.
You gave the majority of it. And I guess my last question would be for everyone. Are y'all concerned about a second wave of COVID entering Amarillo, or are we kinda on the tail end of it? Are we in the clear a little bit?
So it's definitely something that we're preparing for. I think it's one of those things we hope for the best and prepare for the worst. And so we are always, preparation is the key. I think we've all learned a lot in this current situation. And so we'll take those lessons learned and apply them for future situations. And so may that be if COVID spikes again, or for the next time that we have a situation like this. We have, I think, learned lots and lots of lessons that have been very helpful to us. And so I think we have definitely, we've stood strong. And so we will be able to do that even better the next time.
Awesome. Thank you guys so much.
This time, let's go to, if I'm not mistaken, Ariana Martinez of News Channel. Ariana, how are you?
Good morning, everyone. I'm good. This one's probably for Casie. Do we have a number of how many assisted living and group homes we have in the Amarillo area, and how many of those have said yes so far?
I'll have to have that for you next time.
Okay. And do we know about how many tests go to labs per day?
I can tell you that, through the drive-through testing site, we do between 60 and 90 a day. But as far as for the entire city, I don't have that information.
Okay.
And because it doesn't get reported to us, that's something that keeps coming up over and over. I want to just clarify that again. If they go to a private doctor's office or even at the hospital, what gets reported to us is a positive test, not the fact that a test was given. Is that right, Casie?
Yes, ma'am.
Thank you, Mayor. And then about how many results do we get per day on average?
I think, you know, this very specific numbers like this, it's always, I can always get them for you if you'll ask ahead of time. And so this is another, I think, one of these things that I would love to have these kinds of numbers for you. So if you can get these to Dave before the press conference, I'm happy to get this type of information to you. I think, you know, it just kind of depends, like the number of tests the results we get back each day kind of depend on the number of tests that were performed before. Again, like I said, through the public health clinic, drive-through clinic, we see an average of between 60 and 90 people a day. So there may be a 2 to 4 day time delay between the results there. So we might get those. So I would say probably on average, we might get around 100 a day. And some of those are positive, some of those are negative. But again, that's just an off-the-cuff answer, and I would have to get more information for you.
Not a problem. And then for those assisted living and group homes that did say yes, did you say we've already started testing them?
I think they may have already started testing some, but I'll have to dig more into that as well.
Okay. And then the last one is for Dr. Lamanteer. Do you know how many patients are in the ICU and how many of those are on vents?
Yes, I have those numbers. Our total number of ICU patients today in our main ICU is 39. We have 15 patients in our intermediate care ICU. We have 7 COVID patients at this time in the ICU, and 6 of those are on the ventilator. And the remaining patients on the ventilator are up to a total of 15 are non-COVID. So only about 40% of our vents are currently in use, combined COVID and non-COVID.
Perfect. And just to clarify, so there's only 7 COVID related in the ICU, or that, so the 39 is not all COVID?
Correct. There's only a total of 19 patients confirmed COVID positive in the hospital. Okay. Of those 19, 7 of those are in the ICU and 12 of those are in the med-surg unit. And of the 7 that are in the ICU, 6 are on the ventilator.
Perfect. Thank you for clarifying. And that's all I have for you guys today. Thank you.
Thank you, Ariana. At that time, that concludes our Wednesday Zoom news conference for today. Once again, we do these every Wednesday at 11 a.m. I want to thank all of our panelists who took the time out to provide this information to the community today. Thank you for your time. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo, and we'll see you by next week. Thank you.
Thank you.
Thank you.
Thank you.